The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. Today we're going to be talking about women's health issues, and we're going to be talking about a subject that we've entitled hormone replacement therapy. Sounds like a big, long thing, but our guest today is going to be able to help us understand more about this and how it relates to women's health issues. Dr. Shadle is with us today, Eric Shadle, and you practice in a type of medicine that deals with women day in, day out. Obstetrics, I guess, is the way we say this, and gynecology. Is
That's
that right?
That's right.
And so we're dealing with women all day, every day, and
Yes.
one of the things that we deal with as women, or women deal with, is hormones as they change over the life cycle. And I suppose that this is related to what we're going to be talking about.
Yeah.
What exactly is hormone replacement therapy?
Well, hormone replacement therapy refers to taking estrogen and progesterone. We call it replacement therapy because it's typically given to a menopausal woman after she has gone through the menopause and isn't making estrogen and progesterone, and so we talk about replacing it, both of those hormones, as opposed to ERT or estrogen replacement therapy where we only give the estrogen.
So progesterone and estrogen is what we're going to be talking about primarily today.
Primarily, yeah, both hormone, estrogen and progesterone.
Are there any risk involved with taking hormones or replacing them?
Actually, there is. There are several risks associated with HRT or hormone replacement therapy. The one that concerns women more than any other is breast cancer, but there's also thrombosis, DVT, which is deep venous thrombosis.
Which is like a blood clot?
That's right. Gallbladder disease and hypertension or high blood pressure. Those are all risks associated with hormone replacement therapy.
Mm-hmm. And what is the rationale then to prescribe a medication or a hormone like that if there are those kind of risks involved?
Well, that's an interesting question, and one that my colleagues in obstetrics and gynecology will debate at about every seminar that I go to on hormone replacement therapy. But there is a specific rationale for prescribing hormone replacement therapy, and the main one is osteoporosis. 1.3 million women have osteoporotic fractures each year. Half of those are vertebral or in the backbone. 25% of them are in the hip, and another 25% are Colles fractures, which is that fracture in the wrist.
When you fall down and catch yourself.
That's right. And in 1995, the cost of these osteoporotic fractures were $13.8 billion. So this is a huge public health issue in this country. And that is the main rationale for giving women estrogen, because estrogen has been shown in many retrospective studies to reduce the risk for osteoporosis.
I've also heard that it does something with cardiovascular disease, or reduces the risk, some people say.
There are many retrospective studies, again, that show that we reduce the risk of cardiovascular disease by taking estrogen, but of interest is that there are several studies that are ongoing, very good prospective studies that indicate that actually estrogen or hormone replacement therapy not only does not decrease the risk of cardiovascular disease, but may actually increase the risk of heart attack, stroke, those types of issues. And so
it's not really a good reason to take it.
That's not a reason to take it at all.
So you're telling me the best reason to take either of these would be osteoporosis,
Osteoporosis.
progesterone or
That's right.
estrogen replacement therapy.
Yeah, even in the face of the side effects or risk factors that we listed earlier, which is the breast cancer and the thrombosis and those things, the traditional view in the medical establishment is to accept those risks in order to prevent the osteoporosis, because so many women suffer from osteoporosis.
I want to go on and talk a little bit more about this osteoporosis and about how we can maybe avoid it with other things other than estrogen and progesterone, like diet. But I wanted to ask, why is it that the increase comes for cancer risk when you take an estrogen or a progesterone?
Specifically for breast cancer, there are estrogen receptors in the breast as well as progesterone receptors. And there's no question that if we give estrogen to a woman who has breast cancer, especially if that cancer has the estrogen receptors, that the cancer will grow. But we also know that estrogen, through multiple studies, that estrogen actually does cause an increased risk in the breast cancer or breast cancer risk, and that's probably because of these receptors.
So birth control pills, that's why that happens as well?
Birth control pills do increase the risk of breast cancer slightly in a certain age group, and that age group happens to be the women in their 30s who are taking it. But women who take it in their teens or in their 20s, when we look at their risk of breast cancer when they're in their 40s and 50s, we don't see an increased risk, unless perhaps they continue to take it into their 30s and into their 40s. Then there may be an increased risk that we need to talk about. But it's a little different than hormone replacement therapy, because because the birth control pill is made of estrogens that are totally synthetic and are high doses that turn the ovary and everything else off.
Okay.
And so they may not combine with the receptors in the breast like hormone replacement therapy. Right.
Okay, so it's a little different issue. But
so it's a little different issue, and hormone replacement therapy is actually more associated with breast cancer than the birth control pill.
Let's look then back at this idea of estrogens and progesterone in terms of osteoporosis. You say they really do help to avoid that, but are there other things we can do to avoid osteoporosis?
Absolutely. I think the most basic thing that we can do is have a proper diet. And when I say that, most Americans, at least most people in this country, and I know this program goes around the world, but and I don't know exactly what they're saying in Bangladesh or in China or other places, but we find that diet in this country is definitely associated with osteoporosis, so that a high protein diet will cause a loss of calcium in the bones. And animal protein actually causes a greater loss of calcium than does plant protein.
Interesting.
And then the plant sources of calcium, as the graphic shows here, are absorbed more efficiently than our animal sources, to the tune of about 2/3 of the calcium that is in a green leafy vegetable, for example, will be absorbed, as opposed to milk, where only about 1/3 of that calcium in the milk is absorbed.
So so these high protein things are really what's causing the problem. If we look at our diet, we can really be addressing a lot of the issues with osteoporosis other than estrogen therapy.
Yes, and that would be an alternative to hormone therapy, is to simply change our diet to one that is compatible with good bone function and the bone growth that we want to have.
We hear a lot about if you're going to be taking or eating foods that are high in calcium, or taking calcium supplements, or these kind of things, that we need to be having weight-bearing exercise as well.
That's right.
Well, why is that? How does that work?
Well, the bones are constantly resorbing, and that is taking calcium, taking bone out, and depositing bone. And they're actually, there's two different types of cells: osteo, that's bone, osteoclast, which take bone out, and osteoblast, which actually put bone down. And so there's this constant modeling of bone between these two different cells, and exercise, weight-bearing exercise, actually stimulates those osteoblasts to lay down more bone tissue. And so we can prevent osteoporosis by exercising at least 20 minutes every day. And it doesn't have to be vigorous exercise. It can be continuous walking, especially if we can get our heart rate up even to, say, 60% of target heart rate. That will definitely be benefiting our bones because we are putting the pressure on the bones that we need to be.
Now, I remember when I was on a trip to Romania, a mission trip, and I was supposed to take over a bunch of calcium to help those people there that were supposedly having problems with their bones. When I got there, the doctor said that's not going to help them at all because it didn't have any phosphorus in it. Is there any truth to that?
Yes, there is. We do need phosphorus in order to absorb our calcium, and in fact, that's probably one of the reasons we need phosphorus, but there's something else in our diet called phosphates that actually leach calcium out. So we need to be careful. We need phosphorus, but we don't need phosphates, which are in cola drinks and which are in meat. Animal protein has a lot of phosphate, and that typically acts as a diuretic to get the calcium out of our bones.
Gets rid of it. I've heard of Fosamax, a medication that's supposed to increase, I guess, bone density or something like that. Or is there anything to that? Is that helpful?
Yes. Well, getting back to the idea of alternatives to hormone replacement, Fosamax would be one of those. Actually, it's a bisphosphonate. I think we have a graphic here that bisphosphonates is a class of medications that Fosamax is actually an example of. And it's actually not a hormone, and it increases bone density. Studies are very good, or there are very good studies that show that it actually will increase bone density rather than losing bone that we typically see in older folks. It can be used to either prevent, or it can also be used to actually treat osteoporosis.
So there are some other options other than just taking the estrogens or the
That's
progesterones that can help with the osteoporosis. What about so-called designer estrogens? What are they? Do they, in other words, they don't supposedly, I guess, maybe impact one area of the body but the other. Tell us a little bit about that.
Yeah, designer estrogens, one example would be Evista or raloxifene. Raloxifene is actually the chemical name for it, and what they do is actually increase bone density, but they don't increase the risk for breast cancer. And the reason that they don't increase the risk for breast cancer, like estrogens do, is because they act as an anti-estrogen on some receptors. In other words, they will bind to an estrogen receptor, but they won't stimulate it. So that's like an anti-estrogen. And on other receptors, they do act like an estrogen. So for example, if we take raloxifene or Evista and we give it to a patient, it will bind with the estrogen receptors in the bone and thus increase bone density without increasing the risk of breast cancer. But I should hasten to say that there is no medication that is on the market that has no side effects. And though the drug companies would make us think, or like us to think, that we can take these medications and never worry about anything, that they're the answer to all our problems, we know that there's always some problem
somewhere.
And one concern I would have with raloxifene or Evista is that one of its cousins is tamoxifen. Tamoxifen is a treatment for breast cancer.
I see.
And so it does help to prevent breast cancer, but we found that tamoxifen, given for more than 5 years, may not prevent breast cancer anymore.
Oh,
and it may actually increase at that point.
So it works for a time, but then it maybe potentiates it.
Yeah, so do we want to be taking Evista for 10 or 15 or 20 years? I think the jury's out on that, but it's certainly an alternative to hormone therapy that may be promising.
So we really need to think closely about hormone replacement therapy before we get involved. Try and do the basic underlying things like diet and exercise, weight bearing, all that stuff. What about so-called natural progesterone? Some people say it's natural, so it must be safe.
Yeah.
Is it?
Well, if it's natural, it's got to be, right?
It sounds good.
It sounds good. Well, natural progesterone actually is not associated with breast cancer. That's the good thing about it. It's also not associated with heart disease. And what I mean by that is that if we look at synthetic progesterones,
it can't increase those.
It increases definitely. It increases both of them probably.
Mm-hmm. But this one doesn't.
But this one doesn't. There's no convincing data, however, to confirm that it will increase bone density. So I can't say that it will prevent osteoporosis, though some claim it will, especially those in that are more familiar with natural remedies. But there have been a lot of studies that have been done that have not shown it to increase the bone density. But
so in other words, why would you take it if it doesn't help one and it doesn't help the other?
Well, what a natural progesterone will do is, as an alternative to hormone replacement therapy, we've been talking mainly about osteoporosis, and I don't think it's going to do much for that. But what it can do is it can help a lot of other menopausal symptoms, some that we haven't really talked about, such as hot flashes.
Oh, okay.
And natural progesterone, I think if a woman is to take progesterone, she really wants to take natural progesterone because synthetic progesterone has been shown to actually increase the risk of breast cancer. You know, it wasn't too long ago that we thought estrogen was the only culprit in increasing breast cancer. Mm-hmm. And a study came out not too long ago, within the last year, that showed that if a woman took estrogen by itself, her increased risk of breast cancer was as much as 33% increased risk. But if she took estrogen with a synthetic progesterone, her risk was 66% increased for breast cancer. And so we find that synthetic progesterone is something we want to avoid, but natural progesterone, it doesn't appear that has the same effect.
Same dangers.
And it probably doesn't have an adverse effect on heart disease, whereas synthetic progesterone does. Again, synthetic progesterone, what it does is it lowers the good cholesterol, that HDL, it lowers that, and then the bad cholesterol, the LDL, it raises that.
Ooh.
And so the
heart disease then is a big issue too then.
So heart disease is a big issue if you take progesterone, but it doesn't appear that natural progesterone will do that.
Does any of this stuff give you a headache thinking about all the different things and trying to help people out?
Yeah, you have to balance a lot of different things.
And juggle that. We're talking with Dr. Eric Shadle. We're talking about hormone replacement therapy, women's health issues. When we come back, we're going to look at some more things that are involved in this whole scenario. We hope you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Eric Shadle, and we're talking about hormone replacement therapy. We've talked about the fact that a lot of people hear a lot about needing to take estrogen and progesterone, especially when they get past that time in their life when they're no longer having a monthly cycle and all of those different things. We've talked about the fact that there are great risks with that. There are some risks. I don't know if you'd say great. Some people would say great. The increased risk of breast cancer and different things like this that we've talked about. But also we've talked that even though there are those risks, there are some real things that cause us to think about maybe those are positive things to do, like how the effect of estrogen on osteoporosis, so it doesn't affect as much. But you've talked about a more excellent way, in a sense, than even those. Not saying that they don't have a place, but we've talked about diet, and we've talked about exercise, about osteoporosis, and we've talked about hot flashes and how we can, be involved in helping those things in other ways other than hormone replacement therapy. What are some other things that can be used to help with hot flashes other than hormone replacement therapy?
Well, hot flashes are a big problem for many women who go through the menopause. Though I should say that not all women have hot flashes, and so women don't necessarily need to dread going through the menopause. But hot flashes are a significant issue. And one of the things that we can use as opposed to traditional estrogen replacement therapy would be natural progesterone. And we've talked about that before, but natural progesterone cream, it's a transdermal, you put it on the skin, can decrease can significantly decrease hot flashes. Studies have shown an 85% response rate. Clonidine is another medication. Actually, it's a centrally active, to be technical, an alpha-2 adrenergic agonist. And so what it does, it's actually given for high blood pressure many times, but it also has a 80% effectiveness rate in reducing hot flashes. Medications such as selective serotonin reuptake inhibitors, these people know these like Zoloft and Prozac, they're antidepressants, right? And then a natural remedy would be black cohosh. That is an herb, and that has been shown to reduce hot flashes. Probably, most studies would say 60 to 70%.
Well, how much do you take of black cohosh?
You could, well, that's at a food store or at a natural food store. You can find this. They come in tablets, and you can take a couple of those a day. A couple, one in the morning, one in the evening would be a fine way to do it.
So again, the natural progesterone cream is, you've said, it's always better than
the synthetic. That's right. And I think that's probably a good rule of thumb, that we want to stay with natural things rather than the synthetic ones as much as possible.
Now, another thing that sometimes ladies deal with is severe vaginal dryness after menopause, and sometimes hormone replacement therapy is shown to help that. I guess as you described before, maybe tell us how that works, and then what can we do in place of hormone replacement therapy?
Well, what we can do is, the first thing we can do is moisturizers, which should be water soluble. There are things called Astroglide or Replens, but it needs to be water soluble. There are also low dose, very low dose estrogens. If you take a extremely low dose estrogen intravaginally, it does not appear to increase the risk for breast cancer. And there are many low-dose estrogens on the market. And I should say that there is a difference, in my opinion, between natural products in hormones, such as estrogen now, as opposed to bioidentical. I think bioidentical is what we want to be focusing on for the female, the human female, that is, because there are three types of estrogen that a woman's body makes: estradiol, estriol, and estrone. And those are the types of estrogens that a woman should be taking. So that we may call something natural, such as, say, Premarin, the most commonly prescribed estrogen in this country, it gets its name Premarin from its source, and that is it comes from pregnant mare's urine. So Premarin is coming from pregnant mare's urine.
Kind of wish I didn't know that.
And it is natural because
Okay.
it's coming from a horse. But is that what a woman needs? Actually, there's about 21 different types of estrogens in a horse, and they are then in the urine, and they concentrate those and put it in a pill. And that could technically be called natural, but obviously that's not the natural that we're talking about here.
So you want to get into what's really natural for the lady.
What I would call bioidentical. It's what our
Bio.
body, it is what our body makes, and that would be either the estradiol, estriol, or estrone. And there are a lot of products out there, even though they might be synthetically made, they're bioidentical to the estrogens that our own body makes.
I think that's probably true in almost everything you get over the counter. I mean, even these vitamins and different things that they have a lot of, you never really know what's going to work unless you get what's bioidentical.
That's
and
right.
Figuring that out. Well, we've talked about this hormone replacement therapy, but again, it seems that God's way of dealing with things is always better. Why don't we end up by talking a little bit more about diet and how it relates to all these issues?
Yeah, actually, if we had the right diet, I'm not sure we'd even need to be talking about this, because if you look at Chinese women out in the rural parts of the country, they don't have menopausal symptoms and they don't have osteoporosis. And why is that? Because they're living on a simple diet, one that is primarily plant-based, one that doesn't have any or just a very little bit of animal protein, and so they don't have the problems with the osteoporosis. And the fat that is in the Western diet is what increases the amount of estrogen that a woman produces, and she gets used to this high level of estrogen throughout her life, and then she goes through the menopause, and the symptoms often are due to the degree of change in the estrogen rather than the actual level of estrogen itself.
So you were running on high octane and then you went to nothing.
That's right.
And it's like the car just stopped.
That's right.
Okay. Well, again, it sounds like hormone replacement therapy and all these things that God designed us with, hormones in our bodies. The best thing for our bodies, if we're women or if we're men, is to eat what He told us to eat to begin with.
That's right.
And that solves a lot of problems.
That is the balanced way to do it, and it's the way that I think God wants us to do. He gave us that diet because He knows best. He's the one that created these wonderful machines that He's given us.
Well, thank you so much for spending time with us, Doctor, and for helping us again be reminded of what we can do if we have a problem and what really the best is, God's way. And we're thankful that you joined us as well. We hope that as a result of today's program, you have health that lasts for a lifetime.